name is Dr. Kimberly Crittenden, and I'm an obstetrician gynecologist at the Women's Center at Westover Hills. Today, it's time to know your health. We're going to talk about chlamydia. Chlamydia is the most common sexually transmitted disease. It's reportable and it's a bacterial STD. It's very important that you know about it because over 1.5 million people are affected by this disease. And that's probably only half of the people who actually have the disease. Why do we say that? Because unfortunately, a lot of women and men have chlamydia and they don't know it. What are the most common symptoms? Well, most people don't have any symptoms. In fact, 90% of men and 70 to 95% of women won't have a single symptom. It's not that they just didn't recognize it or they just didn't feel it. No, they didn't have any symptoms. Some people will have symptoms. So things you could look for would be an increased vaginal discharge, a color to the discharge, irregular bleeding, spotting in between periods, painful intercourse. So there's a lot of symptoms that could be associated with chlamydia. But remember, the most important thing is most people won't have any symptoms. So it's very important that you get checked. Why do you think you need to get checked for an STD, sexually transmitted disease? Because unfortunately, it can cause serious damage to your body. It can cause problems with having kids. Infertility is a very common problem of chlamydial infections. If the chlamydia infection turns into something called pelvic inflammatory disease or PID, then there's about a 20 to 30% chance that you won't be able to have kids. 1% chance of having an ectopic pregnancy, meaning the pregnancy gets stuck in the tube. So we want to prevent this for you. We want you to be able to have a family. Why else is it important to get checked for STD or sexually transmitted disease? Because it can also cause permanent pelvic pain. That means you just have this horrible pain right here in your pelvis, and you come to the doctor and they can give you antibiotics, they can get rid of the disease, but they can't get rid of the pain. You want to prevent that before it happens. Why is chlamydia important? We know that chlamydia is preventable. It's curable. We can treat you with just simple antibiotics. However, its consequences may not be so curable. So again, they can cause problems with infertility, meaning not being able to have babies, ectopic pregnancies, meaning if you do get pregnant, it gets stuck in the tube and it doesn't become a baby. It could also take your life in that situation, and it can cause problems with chronic pelvic pain, which we don't want you to suffer from. So remember, get checked. This is Dr. Kimberly Crittenden. Thank you for joining us for this segment of Know Your Health.